Well, we all know someone in our lives that suffer from some weight issues, whether it's from an illness or genetic concern. But what options are out there when it comes to weight loss surgery? Dr. Eric Smith, General and Bariatric Surgeon from Georgetown Bariatric and Advanced Surgical Services, is here to tell us more. Welcome back, my friend.
Thanks for having me.
Have a nice Christmas.
It was great. It was
I'm
really
pleased to hear it. I want to talk to you a little bit about what is basically the gastronomic sleeving and how does it actually work?
So the gastric...
And did I use the right terminology?
It's called the gastric sleeve, or sleeve gastrectomy is the two most common terms. And it is the most common procedure that we do. It's now the most common procedure done in the United States. And basically what it does is it reduces the size of the stomach. It's what we call a restrictive procedure, which restricts how much food a patient can eat. They'll feel full much quicker, which ultimately will help them lose weight.
Okay.
And talk about the size that takes your stomach down to. I know you said the size of a football or a banana. What's the comparison?
A lot of people will look at the sleeve and they'll say it kind of takes the stomach down to the size of a banana. The way I explain it to patients is right now our stomach is like a water balloon. You know, if you think of a water balloon, you put it on a faucet, you turn the water on, it'll expand 10, 15 times its size. When we remove the large part of the stomach, that expands. And so now your stomach is like a long, narrow tube. And you think if you turn the water on now, when it gets to the top, it's full. It's not going to stretch. And so it will reduce the capacity down to about an eighth or a tenth of what the stomach used to be.
And then we're looking at what an actual stomach looks like now, aren't we?
Correct.
And this is before the gastric sleeving,
Right.
of course, as well. But what are the advantage of the gastric sleeve? Dr. Smith, talk us through that.
You know, the sleeve has become very popular, and here you can kind of see the staple line forming, and that part to the right will be removed ultimately. You know, the sleeve is very popular because we can achieve essentially the same weight loss that we were achieving when we were doing gastric bypass, but we do not affect absorption. So vitamin deficiencies, protein deficiencies. Now, you and I can get a vitamin deficiency if we don't take enough of a vitamin in, but there's nothing done surgically that predisposes you to that. So now patients are able to lose a significant amount of weight, but we're not increasing their risk of those long-term vitamin and protein deficiencies that we would cause when we create malabsorption. The stomach does not absorb anything.
Well, comparing a gastrectomy to some other weight loss programs, talk about the percentage of weight loss patients will lose with the gastrectomy compared to other options.
Sure, and that's really ultimately the question that's important for patients because they all have their goals.
Yeah.
Well, are they realistic? And so when we look at weight loss procedures, we look at excess weight loss. So we take someone's actual weight, subtract their ideal body weight, and say what percentage of that weight can you lose? If someone's watched The Biggest Loser, they don't look at pounds, they look at percentages to make it even. And so someone who has a sleeve gastrectomy at 2 years can anticipate losing 70 to 75% of their excess weight. Now, I've seen patients lose more than that. Depends on how strict they are with their diet, how much exercise they do. And in comparison to, say, maybe a band, a laparoscopic gastric band, that number is going to be more like 45 to 50%. Laparoscopic gastric bypass is around 70 to 75%.
Okay. Whilst we're talking, we're just going to bring up some before and after pictures because you really do have some incredible success stories. So when we're looking at these images right now, Dr. Smith, are we talking, you see a dramatic weight loss within the first year?
Yeah, you know, the majority of the weight is lost in the first year. By far, nearly most weight is lost in those first 2 years. Now, it doesn't mean the surgery goes away, but that's
because
when
it's done.
Right. The surgery's still there. It's a tool that the patient can use. So some of those pictures you saw, one of those patients was, I think, at 6 months. One of those patients was about 9 months. But, you know, we'll see patients at the first year lose anywhere from 60, maybe even 65% of their excess weight in that first year.
And that's really life-changing, isn't it, when you think about it?
Are there any age restrictions on that for people watching at home? Yeah. Is there anything that they should be concerned about before contacting you, or just reach out and you'll decide if a patient is
Not really. I mean, the majority of our patients are 18 years of age or older. There are some programs in the country that do pediatric bariatric surgery, and those are usually part of children's hospitals and things like that. But I've had patients I've done sleeves on in their early 70s. You know, you don't treat a number, you treat a patient. You know, there's some 50-year-olds that are very unhealthy, but there's some 70-year-olds who are significantly limited by their weight, and if we can get that weight down, we can increase their life expectancy and their quality of life.
And this is the man, everyone,
Yeah.
who does the most of these type of surgeries in this state. If you want to find out more information about Dr. Eric Smith, there it all is, up on your screen right now. Listen, if you're a little bit unsure, you also have some great information on your website as well, and you also do some fantastic online seminars as well as seminars that people can come in and have that conversation conversation. Dr. Eric Smith, we really appreciate you
Yeah,
coming in.
absolutely.